DocTalk Live. I'm talking loud just to make sure y'all can hear me. I'm at my office, Ortho, Alabama. I'm with Sean Finnerty today. Sean, thanks for coming in. Sean is with a company called ControlRad, which is pretty cool technology. This has been out for like less than a year.
Right.
And what it does, the way I understand it, is it lowers the radiation dose during X-ray procedures, which there are lots of procedures that are done under X-ray. And it cuts the radiation dose, right? So it's called control radiation or ControlRad.
Right.
Tell us a little bit about this technology.
Yeah, sure. Thanks, Dr. Goodman. So ControlRad is a company based out of Petrie's Corner, Georgia. We've got a technology that includes a hardware component and a software component that we can retrofit currently OEC C-arms with a semi-transparent titanium filter system that we mount directly on top of the machine's collimator here on the bottom, and then we install a software component into the workstation itself.
So the radiation comes out of here, and this is the capturing area. Okay.
Yep.
And so you put some stuff in there.
Mm-hmm.
And what does it do?
It filters the radiation at the source of the actual X-ray. And so we're narrowing the beam and focusing the radiation on exactly where you need it and filtering it out from the places that you don't need it. And so your benefit's bifold. You get less DAT or less scatter radiation to the staff in the room as well as the patient, and you get enhanced image quality inside the region of interest that you've selected because you're pointing all the radiation through that box that you've selected using our tablet.
So this is the tablet.
Right. And so the user would identify a region of interest just by swiping a line or drawing a circle.
This is your knee, Sean,
Yep.
and we took a shot of your knee earlier, and this says we've lessened the typical radiation exposure by 74%.
Exactly right.
Now, why not just use pulse and low dose? Those are settings on the X-ray machine.
Excellent point. You know, a lot of the commissions have come out and said that you need to get radiation as low as reasonably achievable. You can use ControlRad in conjunction with your pulsed X-ray, in conjunction with your low dose if you like. The beauty of ControlRad, though, is you're getting that dramatic reduction in radiation, and you're not at all affecting the image quality or the workflow. So sometimes if you're using a low dose, your image quality might suffer. But with ControlRad, you don't get that issue. We travel around the country, more hospitals are looking at potentially upgrading to a flat panel detector, which can cost upwards of $200,000 or somewhere in that if you're looking at an OEC. And what we say is, you know what, save your capital expense, and this works really well in a hospital setting. Save the capital expense, we'll retrofit your existing 9900 with the ControlRad technology. You're getting dramatically less dose. You're optimizing image quality where it's already pretty good. And then that kind of can serve as a band-aid until you're able to afford that capital expense later. And then at that point, we'll probably have the technology approved for the flat panel detector then as well.
Mark, have I missed any questions?
No, I can see where like if you had 4 or 5 in a surgery setting, instead of replacing 5 at $200,000 a piece, $1 million, you might spend 5 times 35,000, $165,000.
Right, or
Especially
the
if they're
per
doing
case
like
model, which works
But
pretty well.
again, you don't get paid more
Right.
to unfortunately.
Which is unfortunate.
It's unfortunate
Very
because we could do a whole DocTalk Live on the risks of radiation
100%.
exposure. And the risks of radiation exposure is really not to the patient. It's really to the staff.
Mm-hmm.
It's really to the people like me who are standing next to
Sure.
the beam.
And you're here all the time. The patient comes once and they're gone. You're doing
Right.
procedure after procedure.
Yeah, it's really about you, and it is
Sure.
unfortunate. I think earlier we talked about bogey smoke and how that played out, and there wasn't additional reimbursement back in the day. And I think the hope is that some of the coalitions and the FDA start taking radiation reduction seriously, and Centers for Medicare can start to maybe increase the reimbursement options, because there are technologies out here that can help protect you, and you're not going to die of some strange cancer in 10 years that could be linked to radiation.
I did a study once where I used regular serum X-ray, and then I switched to pulse and low dose.
Mm-hmm.
And it cut the radiation exposure in half. The problem is it didn't give the quality images. What
Right.
you do is you focus the radiation,
Mm-hmm.
you get the same image quality, you get the best image quality with less exposure.
Exactly right.
So it's great technology.